facial closure. نصر. اللي عملوا نصر نصر. السلام عليكم. نصر فاشيال كلوجر نوفل معلش مرة ثانية. شوف Nasr Fascial closure novel device for facial closure in laparoscopic surgery. Laparoscopic surgery, as we mentioned before, is growing, increasing a number of operation, morbidity, increase, especially the board-side hernia. Board-side hernia is rare, 1 to 3%, but it is must be avoided, as we said in laparoscopic surgery now. Any board 10 millimeter or more must be closed. The problem in our society is that the facial closure devices is expensive. Facial closure stores about 30,000. So all the facial closure devices expensive, not present. Malfunction of the facial closure is common. I have many facial closure devices in my center, but most of them malfunctioning, broken. The single use is expensive per case here. So laparoscopic surgery to avoid a board-side hernia, we need to close the board. Board-side hernia, there are 3 variants of trocar-side hernia or board-side hernia. في the early onset or late onset وفي special variant. The early onset variant hernia occur immediately after the procedure and commonly result in a small bowel obstruction, particularly in Richter's hernia. The late onset variant occurs several months after the procedure and is characterized by the local abdominal bulge but no small intestinal obstruction. The special variant indicates adhesions, complete dehiscence of the whole abdominal wall and characterized by a protrusion of omentum or small intestine. What about the risk factors for trocar-side hernia? The risk factors for trocar-side hernia are obesity, length of the surgery, age, diabetes mellitus, incision enlargement, wound infection. If any of these risk factors exist, effective facial closure must be done in the laparoscopic procedure. Board-side closure, since the invention of laparoscopic surgery, new technical difficulties have appeared. Facial closure at the board side is one of them, particularly when a big trocar are employed or when board side had been dilated for organ extraction like gallbladder extraction. Facial closure is currently a problem due to new technologies like single board laparoscopic surgery. The risk of problems at the board side has been reduced significantly since the first report of herniation at trocar site following laparoscopic surgery. The typical closure method, the manual closure from outside for fascia at the board side, can be difficult and tedious, frequently requiring big skin incision or blind suturing of the fascia with the risk of imperfect suturing, with the risk of intraperitoneal organ injury or damage. Several methods for trocar site closure have been developed, but many of these are expensive and or not easy to use or difficult to use. The objective of this study, Nasr Fascial closure device, was to evaluate the effectiveness and safety as well as the applicability of a novel device invented locally for trocar site closure. The description of our device is a unique design consisting of a single piece of a thin needle. It is a needle rather than device. Needle-like solid metal rod of 2 to 2.5 millimeter in diameter and 17 centimeter in length with a pointed edge. There are two consecutive slots on with two reverse inclination just above the end of the rod on two opposite sides, as we will see in the figure now. The distal or the front slot is used for insertion of the suture material, and the proximal is used for retrieval of the suture or the loop. This is a certificate عشان دكتور جمال قال براءة اختراع باسم رزان نصر الدين. هو رزان is a pharmaceutical student. هي اللي عامله التكنيك، هي عامله النيدل مع her father نصر, my brother نصر. This is a description of the needle. Has two slots, one distal and one proximal. The distal one for insertion of the loop, the distal for retrieval, as we will see now. This is the tip of the needle. Two slots magnified here. Nasr Fascial closure needle or device enter between the board and the skin. We insinuate the needle in the layer of the abdomen until we enter inside the peritoneal with the camera from inside, seeing the needle, inserting the loop inside, and we will leave the loop and enter from the other side to retrieve it at any facial closure device. After finishing the laparoscopic maneuver inside the abdomen, we proceed with the board side facial closure. We grasp the facial closure device with our right hand and the suture material, Vicryl or BDS, with the left hand, and insert the suture material inside the distal slot of the device in a horse bridle-like shape. As you see here, this is the needle with this is from inside the abdomen. Then insinuating the device with the thread inside it like a loop between the skin and the board to be closed in a reasonable distance from the edge, about 5 millimeters, to have a good bite or grip of tissue, and in a suitable position. Then we advance the device in the insufflated peritoneal cavity under vision, carefully to avoid injury to any intra-abdominal structure such as the viscera or solid organ. As you see, this is the needle inside the abdomen, and we'll withdraw the needle to dislodge this loop inside the peritoneal cavity. Then we withdraw it back, leaving the loop of the thread inside the abdomen after dislodgement of the loop from the slot, as you see here. Then we insert the device again without a thread with our right hand in the opposite side of the board between it and the skin, and manipulate it gently in the same way as before to enter inside the loop that previously inserted in the abdomen. We now inside the abdomen, and we will manipulate until reaching the intraperitoneally. We will proceed with the device to enter inside the loop inserted before, as you see here. And we will apply traction to the loop from outside to be impacted in the proximal slot. And we retrieve the device with the impacted loop in the proximal slot to be retrieved outside the abdomen. After that, we apply gentle traction on the loop from outside like a horse bridle with our left hand to make the loop inside the abdomen impacted in the proximal slot of the device to retrieve it outside the abdomen with continuous gentle traction applied on the thread to avoid its dislodgement from the loop, from the dislodgement of the loop outside the slot. Uh, Now, on both sides of the board, we have one side with the loop and the other side with the two ends of the loop, free ends. We now perform an extracorporeal suturing like any device, any facial closure device. We can use our finger, surgeon, our assistant, to close the board side during this maneuver to keep the pneumoperitoneum. This is the technique. New device evaluation. In this study, the novel device was evaluated with a focus on its effectiveness, safety, as well as the closure time. For evaluation of any new device, the following should be evaluated: effectiveness, easiness, time factor, short-term safety, as well as long-term safety. Our results were significantly lower failure rate, 0%. None of the cases needed any further intervention for closure. The only intraoperative complication noticed was minimal bleeding with 5 cases, 2.9% during the facial closure. No bowel, vascular, or visceral injury occurring during facial closure. The success rate of surgery was 100% with no case needed to be redone or converted to open surgery. Facial closure device as the incidence of laparoscopic trocar site hernia increased. Many techniques were developed to overcome this complication. Shahar et al. Classified the board closure techniques into 3 main categories. The first category include techniques that use assistance from inside the abdomen requiring 2 additional boards. The second category include extracorporeal assistance technique requiring only 1 additional board for the scope. The third category includes techniques that don't require any additional board or visualization at the manual closure from outside with its risks. Nasr Fascial closure device, our new device, can be included in the second category. In this study, the precision and uniformity of window closure were assessed. Nevertheless, over the short and long-term follow-up period, there was no trocar site herniation. Due to the rarity of trocar site hernia, it accounts for 1 to 3% of the cases. The majority of the earlier research examining trocar site closure device found no post-operative herniation in a small patient sample. Advantages of Nasr Fascial closure device: it is distinguishable from the others in easy to use, fast performing, easy to be cleaned and sterilized, and it is a simple needle rather than a device. It is durable. The malfunction of Nasr, it is liable to be broken as we manufacture it locally in our it is like a homemade device. It is durable, less cost, can also be used to control bleeding from the board side if occurred as any facial closure device. There are limitations in this study. The current study has several limitations. First, it didn't evaluate the comparison between the novel device and the conventional device such as Carter-Thompson system. However, the objective of this pilot study was to evaluate the safety and efficacy of our novel device. In another research study, this novel device will be compared to other methods in randomized control trial to further prove the evidence for its effectiveness and safety. As it is a novel device, I repeat the video of there is time. This is the video, complete video for the steps of Nasr Fascial closure device. The tricks in this maneuver: you must push the needle more in the peritoneum to dislodge the thread from the device. Thank you.